Well, violence against children cost South Africa 238.58 billion rand in 2015. This according to a recent study commissioned by children's rights organisation Save the Children, which found that the long-term effects of emotional, physical and sexual abuse has a direct impact on the country's economy. Well, Dr. Celia Cha is the research manager who worked on that report, and she joins us now on the desk. Good afternoon, Doc, and thank you so much for making time to join us on the SABC News Desk.
Thank you so much, Kirshni, for having me.
Celia, 238 billion, a staggering amount. How did you get to that figure? Take us through.
It is indeed a staggering amount, and before I go through how we got there, I just wanted to say it's actually an underestimate.
I see.
So the real number is likely a lot more, and I'll explain why. How we got there was we looked at, we worked with experts and global experts in the field, and we looked at a host of things. First of all, we included the costs on child welfare costs. We also looked at loss in productivity, for example. So early exposures to violence against children leads to a host of negative mental and physical health outcomes, as well as loss in productivity. For instance, an individual who experienced physical violence as a child earns on average about 11.6% less a month. So that's a major loss in productivity. The costs also take into account losses when violence against children results in the child's death, such as child homicide, infanticide, etc. The biggest cost was loss in the healthy years that an individual experiences that they lose as a result of violence against children. So the number of healthy and functional years that one loses as a result of physical violence, sexual violence, etc. When you add all of this up, you get to 238 billion. And what that means is it's not how much we spent as a country, it's how much we have lost due to children experiencing violence, not reaching their full potential. As a result, it's a loss to the economy.
All right, Doc, you're speaking about child welfare costs. I'm hearing you, loss in productivity, loss in physical and functional years in a human being. Are we dealing with an epidemic of violence against children in South Africa, or is this being alarmist right now?
I think calling it an epidemic is probably quite accurate. It is an epidemic. The statistics are really high, and as I said, this is an underestimate. When you look at the prevalence rates, just earlier this year, the Optimist study released the first nationally representative prevalence rates. And in South Africa, sexual violence is about 7.2%, physical violence is about 26.1%, emotional violence is about 13%, and neglect is about 12%. So these are huge numbers. So I would agree and say it is an epidemic, and it is something to worry about.
Celia, why is this problem still so pervasive in contemporary South Africa? And what should we be doing in terms of prevention and early intervention programs?
So it's pervasive for several reasons. We are a rather violent nation, and linked to your second question is currently South Africa has more of a statutory response approach. We wait for violence to happen and then we deal with it, which is important in its own right. However, we need to take a prevention approach, as you've mentioned. We need to prevent violence before it happens. And going back to the costing study, what the study essentially says is if we can invest in prevention and early intervention, preventing violence before it even happens, we can essentially help to build a stronger economy.
How do we begin to prioritize our more vulnerable areas? We do understand that poverty doesn't equate to violence, but how do we start to uplift children in these difficult situations in these particular areas?
One of the things that Save the Children South Africa is working on is on positive parenting programs. So in some of the poorest areas with the most vulnerable children is working with parents on violence prevention. That is to help them build a strong relationship. Of course, financial means are limiting in these areas, as you indicated, due to poverty, etc. But within the means that they are able to work with, what are the ways that we can help parents build a positive, strong, warm and supportive relationship with their children, particularly even starting from pregnancy. And as a result, they build that relationship, they find less harsh and violent ways of punishing their children, of engaging with their children. As a result, we can prevent and reduce violence in these areas.
Just on that note, it becomes very easy, almost the go-to guy, when it comes to criticizing the SAPS and social services, etc. But they themselves are experiencing challenges like a lack of funding or lack of skills training. How crucial is it that we start to cultivate a sense of personal responsibility, a culture of active citizenship when it comes to looking after all our children?
Kirshni, I think that's absolutely crucial. general public needs to become aware of this. So as part of our Violence Unwrapped campaign at Save the Children, which we launched on the first day of 16 days of activism, it's going to be 365 days for us for 5 years. And a big target for us is the general public. It's for the general public to understand, yes, it is we've accepted it, it is a norm, it could be part of our culture, of our society, but we can change that. These things can be changed, so we absolutely need to take action, and we also need to speak up. Those of us that have experienced violence as children need to speak up, share their stories, show how you've overcome it, and so for people, so it's no longer swept under the rug, so people understand that it's okay, we can talk about it, and let's do something about it.
Thank you, Celia. Thank you for sharing your insights with us on the SABC News Desk. That is Dr. Celia Chow. She's a senior researcher who worked on the Save the Children report, joining us on the desk this afternoon.